You're watching the Fox 11 News at 6.
I just take my mouth shut. It's something to do with something. I don't know. Look it up.
Most of us are looking to get healthier, and we're not asking our doctors about it. TikTok and other socials are full of videos offering the latest health hack, everything from drinking olive oil to taping your mouth shut at night.
Dr. Geeta Nayyar is the author of Dead Wrong, Diagnosing and Treating Healthcare's Misinformation Illness. And Dr. G is joining us now. Good to have you. I haven't seen this taping your mouth shut trend. Why are people doing this? Do I want to know? And this is specifically at night.
Well, I got to tell you, first, thank you so much for having me. I mean, to me, this sounds about as effective of a weight loss strategy as it is for snoring. So it is, again, a great prime example of mis and disinformation. It's simply not true.
So how do you know what is true and what isn't true other than common sense?
Well, look, I think the reality is we're living in a tech-forward world, right? And we're living in a post-pandemic world where everyone is hungry and thirsty for health information. And as a physician, I'm excited that people want to be knowledgeable about their health. But the truth is you need to be mindful that not everyone that is an expert on social media or online is a true licensed healthcare professional. So number one, you want to look at the source. Is this grounded in evidence? Is this evidence-based medicine found in medical journals? And is this duplicated and replicated across the industry of medicine as a standard? Secondly, you want to look for wild claims, right? Curing male pattern baldness. The cure to a complicated scientific problem is generally not that simple. So being mindful of really extreme claims. Also checking to see what is it that they're selling, because often that's one of the biggest red flags, is that some supplement, some lifestyle choice is being sold, or some subscription is being sold. So those are some quick ways to know, but ultimately you really want to make this decision with your doc. And I often sit down with patients and say, hey, I want you to read, I want you to know about your diagnosis, I want you to ask me questions. Here's the top 3 websites I recommend, or here's some of the influencers that I follow, but that are reputable and credible.
Okay, well, I'm just going to jump to that then. Who are those reputable people on social media to follow to get this pertinent and accurate non-misinformation?
Well, first of all, you want to be thirsty and hungry for that knowledge. So kudos to everyone out there interested in the human body and wanting to learn about it. But number one, you want to look at the website. You want to see, is this the CDC? Is this the NIH? Is this a patient advocacy organization? So again, if you have diabetes, check out the American Diabetes Association. I'm a rheumatologist. Patients with lupus, rheumatoid arthritis, I'm sending them to the Lupus Foundation, the Arthritis Foundation, and those folks have people that they follow. They endorse certain physicians and influencers in those specialties. And here's the biggest kicker. Follow someone that is actually accountable for the information they're giving you. What do I mean by that? So if you're following Dr. XYZ on Instagram or TikTok, see if you can make an appointment with them. See if they actually are a licensed professional, and they'll actually take care of you. So if the advice that they're putting out there is something that they're willing to back up, and they actually have a practice or an institution that can see you, this is going to be one of the things that you're looking for. But again, also just checking the data. Is this up-to-date information? Are they citing things that are up-to-date with this date, this year, as opposed to citing things from 20 years ago or based on old information? So there's a couple of quick tips that you can look out for.
Yeah, and if they do have a practice, then they could potentially get sued if they give you misinformation, just like news organizations that could get sued for misinformation versus random generic people on X who don't give their names. So just last month, the Surgeon General of the U.S. called for a warning label on social media platforms. He says social media is causing a mental health crisis among kids. Do you agree with that? And what would that look like?
Well, look, I think that we are learning when we talk about new technologies like social media, when we start thinking about artificial intelligence, we have to be mindful that these are exciting innovations, but they're dangerous when used in extreme situations, and mis and disinformation is right up there. So if we look at social media, if we look at what it's done to our children, it's dangerous. And we need to examine what is the right role for social media, where does it belong? And when we think about mis and disinformation, It's not new. The facts and getting the facts wrong has been around since the Black Plague. But because of social media, mis and disinformation are traveling 6 times faster than the facts. And what does that lead to? That leads to delayed diagnosis. That leads to blowing out your liver, blowing out your kidney because you followed some regimen or overdose on some supplement regimen without understanding the side effects. Not to mention unnecessary anxiety. I can't tell you how many patients come in and are worried about a treatment before we've even had a chance to discuss it because someone has gotten to them before I have.
Yeah.
So there are numerous ways that we have to be mindful of how social media is used in a health context, and particularly when we think about our young children and getting addicted to some of these technologies.
And adults, too, that's for sure.
And adults.
Yeah, okay.
That's right.
Her book is called Dead Wrong, Diagnosing and Treating Healthcare's Misinformation Illness. Dr. Geeta Nayyar, thank you so much for being with us tonight.
Thank you for having me.
Great stuff. Really important. We'll be right back.